Good morning. It's Richard Edelman from Washington, D.C. I'm here for the IMF meetings. I'm joined by Courtney Gray Haupt in D.C., also Jennifer Hauser in New York, plus our panel of experts who will convene momentarily. This is our fourth annual Trust Barometer. We are deeply excited about the prospect of telling you this story. Um, we actually have just come out of the field. We are 16 markets, 16,000 participants, 1,000 people per market. Um, and I think actually you'll be quite stunned by the results. Before I get into this results, I want to set a context. You'll remember from prior trust barometers. First big trend, the mass class divide, that there's generally a difference in attitudes towards institutions for the top quartile and bottom quartile. Second big finding is that business is the most trusted institution, well ahead of government and media, NGOs in the middle. Third big trend, trust has gone local. Traditionally, trust is conveyed top down. For a period of about 10 years, it was conveyed peer to peer. Now, trust is local. The third and the fourth point is the battle for truth, the reality that we don't have agreed facts. So that's a context. Now, let me try to give you the specifics on health. The first is, and again, this is based on the four reports we've done before, authority is dispersed. It is no longer simply a top-down game. It's also very much friends and family and classic experts, doctors, etc. Second, health is multidimensional. Health describes not just my physical health, but also my mental health. This is a key outgrowth of COVID-19. Third, I feel empowered to manage my own health. That is the new norm. I am now believing that I can find good quality information by myself. I don't have to just rely on what my doctor says. And lastly, influence is local. You'll recall last year we talked about the air game and the ground game being the pastors or the pharmacists, people close to you, the air game being the classic institution, CDC, etc. You need both. So let's get to the data for this year. The first key finding, we see a gigantic rise in fear of politics entering the hallowed halls of science. And the jumps are correlated to the places where there were elections this year. Even in markets that heretofore were fairly unpoliticized, like Japan, we've actually gotten over 50% of people to say science is politicized. This is a first. And these are big jumps in some of these markets, like Germany as well. So there's a correlation between electoral process and this fear of politics and health. We also see that people feel more ill. Over the period of time, we see a deterioration of sense of self. And it's particularly true in Western democracies. It's become also a matter of my mental health. It is not just my physical health. I just don't feel good. Our institutions are failing us on health. For the first time, none of the institutions is in the trusted category. So it's not business, it's not NGOs, but it's certainly not government, and it's also not the media. None of them are actually meeting the bar for me in meeting my health needs. Also, very important, I think that these institutions are actually getting in my way of getting care. This is a matter of grievance. This is something that I feel angry about. Again, you'll remember our January Trust Barometer result, the descent into grievance, the rise of hostile activism. This lack of access is part of it. We also now actually believe that our leaders lie to us intentionally on health matters, whether it's business, government, or journalists. And you'll see a shocking statistic on media shortly. Here it is. The deterioration since COVID in trust in health journalism is absolutely stunning. Look at the double-digit drops across almost every one of the 16 markets that we cover. And we're now in a place where only 38% of Americans believe that which they read in the media about healthcare. It is a shocking deterioration of position that is across gender, age group, income, and political party. This was stunning to us. We thought this was a left-right issue or a young versus old issue. Not true. It is a universal loss of trust in journalism about health. Also, I have much more confidence in myself. Remember last year we talked about empowerment. Well, now I actually think I'm the one who can go find trustworthy health information online, in some social post on TikTok. Also, I'm the one who can tell good advice from bad as to health. Again, a shocking development and a shocking level of consistency across the age groups. Jen, take it from here, please.
Thanks, Richard. What this comes down to is health influence, referring to the various factors and entities that shape our individual health behaviors, beliefs, and decision-making. Think how important that is. But traditionally, that health influence has been very narrow in its scope. But as our data reveals, we're seeing health influence broadening to a spectrum of sources and contributors that impact how people perceive and manage their health on a day-to-day basis. So let's dive into this first finding. When we ask the question, who do you trust to tell you the truth about health issues and how to protect public health? Clearly, it's my doctor, it's my friends and family, and thirdly, it's my CEO or my employer. But what you'll notice across these first three is they're all local. They're all within my proximity. They're all familiar to me. But when you venture outside of this inner orbit to heads of health NGOs, government leaders, healthcare CEOs, and journalists, you see trust decline. When we ask the question, and this is so important, who influences your health decision? Clearly, it's still my doctor, but you'll see here friends and family, medical scientists and health experts are on par with one another on equal footing, followed by people with similar health conditions as me, content creators without medical training. And you'll see on the right side with this 18 to 34 cohort, this group is much more influenced by non-institutional sources than their older counterparts. We're also seeing a double-digit surge in peer-driven decisions that just disregard provider advice. In the past 12 months, our respondents said they've disregarded their provider's medical guidance in favor of advice from friends or family and social media. But notice these surges, these really high marks here. You see globally up 12 for friends and family, up 10 for social media. But you also see surges across every single age group, including some of these older populations. And when we ask the question, who do you trust to address the full range of your health issues? We heard some interesting things. First is just over 50% say their healthcare provider is slightly or not qualified to take care of their full range of health issues. We know that health is defined more broadly than ever for people today. It's certainly beyond the physical. It's mental, it's social, it's environmental. And if my provider's not able to address these, I go to the following sources. First, non-institutional, up high in front. Second, institutional. You start to see this trend now as we're going through these slides. And thirdly is my communities. And I still may go to my healthcare provider as a last choice. And to be a legitimate voice on health, academic training is not the only credential today. People told us that when they consider someone a legitimate health expert, certainly formal academic training from prominent, trusted institutions, still very important. But so is personal experience with health issues. So lived experiences that providers and other healthcare professionals have, if they're willing to share their own personal experiences as a patient, as a caregiver, a big credential, according to our respondents, followed by those who have benefited me in the past with their advice. We think this shows a trend in how people are valuing deeper relationships with their providers today, one that is based on transparency as well as human connection. So let's dive now into the youth health ecosystem, which I think you're going to find very interesting, which adds to this reconfiguration that we're seeing of the health ecosystem. You're going to see here an acceleration of young people's consumption of health information. And you could say young people are creating their own health ecosystem and doing what Gen Z does of pushing boundaries and challenging what we've seen in the past for health influence and decision making. So let's dive into this first slide. We're seeing a spike in the belief that the average person can know as much as a doctor, especially amongst young people. Globally, across age groups, this is coming in at 35% plus 5 points for the average person who has done their homework. Research is they're just as knowledgeable on most health matters as doctors. But you see on the right side, younger respondents twice more likely than older to say the average person can know as much as a doctor. Young people increasingly engaging with health information. On a monthly or so basis, I consume traditional health media at the original source, traditional health media sent to me on social, and a surge in popularity of what we've seen of independent health media, podcasts, and newsletters, not just popular, but also trusted. And young people aren't only consuming this information, they're also creating it. They're amplifying it, sharing their health news, their experiences, their opinions. Again, monthly or so basis, I share health-related news items, plus 6 for this younger cohort. I'm sharing my personal health experiences online. I think many of us have seen this, these communities sharing pretty private information with their communities, coupled with their own health opinions online. Young people also most likely to make health decisions based on uncredentialed advice, coming in at 34% globally. People without formal medical degrees or health credentials have a big influence over my decisions. And again, you see here on the right-hand side, younger respondents twice more likely than older to heed uncredentialed advice. And I will say this comes at a price, because what we see here on the next slide is that most young people have made a health decision they regret due to this misinformation. So again, globally, 43% have regretted a health decision based on misinformation at least one time, but we see how this grows to 58%, almost 6 in 10 young people regretting a health decision based on misinformation, all driven from 5 sources of information you see here on the right: user-created content platforms, independent content creators, friends and family, and so on. And ironically, these are all sources of influence we've seen on previous slides that younger generations have told us that they trust. So with that, Courtney, I'm turning it over to you.
Thanks, Jen. So moving from the youth health ecosystem that Jen just told us about to look at the health landscape overall, we find once again that the larger societal trends of polarization that Richard talked about at the start are really seeping through into the patient-provider relationship. So let's begin with a look at public health and how we see this political polarization really impacting the public's perspectives here. So what we see is that since COVID, at a macro level, support for global health organizations has become politically polarized. And at the beginning, when you look at that global number, we see that 63% of people globally say that the pandemic increased their support for their country joining global health organizations. But when we dig into the numbers, we see that this is actually a divided situation based on political affiliation. We see in that middle section that 73% of people on the left say that the pandemic increased their support for their country joining global public health organizations. But when you look at those on the right side, we see it's really only 52%. And in fact, 48% of those on the right say the pandemic actually decreased their support for participation in global health organizations. And then you look closer at the US, which is a really interesting example of an extreme case of this dynamic. 79% of Democrats support and 33% of Republicans do, with 67% of those in the Republican mindset saying that the pandemic actually changed their view, and they do not support participation in these global public health organizations. And what we see is that the political dynamics do not stop there. It comes at the personal level as well. We see at the individual level that personal politics is now seen as a qualifier, or in fact, a disqualifier when it comes to people choosing their healthcare providers. Over a third of respondents told us that they will stop trusting their provider's advice or stop seeing them entirely if they do not share the same political beliefs. Quite a statistic, especially when you look at the spike in young adults there in that middle column. Nearly 1 in 2 young people say they are likely to choose their provider based on politics, and that's double the rate that we see there in that 55+ group. So how else are we seeing this political dynamic intersecting with healthcare trends? Well, we do see it playing out when it comes to the topic of childhood vaccines. We see here data that is broken out across people who say that they would give their children all vaccinations, some vaccinations, or none. And first, when we look here at the global data, we see that even though anti-vax conversations are loud and have been generating so much attention, the actual percentage of people globally who say they would opt out of immunizing their children entirely is relatively small at that 3% mark. However, this was offset by the concerning finding there in the middle when we look at our 18 to 34-year-old group. What we see is that younger adults are those most likely to say they would not fully vaccinate their children. They also have the highest percentage of respondents in the vaccine uncertain category there in the middle, that 32%. And so if you think about the group of people who are either today's current parents or future parents, this is certainly a very concerning statistic. When we see this vaccine uncertain middle category being so high, it made us want to dig a little bit more deeply into that vaccine uncertain group. And so what we found by looking a bit more at how are these young adults in that vaccine uncertain group influenced by social media, peer experiences, but also from these other traditional voices, what we found were interesting on sort of 2 fronts. First of all, we found that the vaccine uncertain do listen to healthcare providers and seek out scientific expertise. It's at a lower level, though, from those who are fully vaccine supportive with all vaccinations. But on the other hand, we found that this group is also much more likely to be influenced by social media and the personal experiences of others. And those numbers have jumped up 14 points if you sort of look at that differential in social media, and a 7-point difference between the 2 groups when we look at others' personal experiences. The fact that we see that this uncertain group listen to their providers, indicates that there's still an opportunity to reach them, to help them change their minds about vaccination and make the right choices for their families. But the fact that they're acting on social media and that peer advice certainly lends itself to the lack of influence that we see growing with science in some cases. It influences the power of peer experiences, and it really does set up the question of how are we able to help health and science regain the influence that we believe it needs to. Which leads us to our next chapter. The positive news is that we do believe institutions and providers can indeed regain this health influence. Fundamentally, and really interestingly, we believe this comes down to effective communications. And there are 5 imperatives central to regaining health influence. The first one right here is relevance. For patients to see you as a legitimate health expert, they must see that you understand people like me. We heard this from over 2/3 of respondents across age and politics. And what we often say is that just like you think about putting those academic credentials on the wall, you have to make your understanding of what patients need and are coming to you for crystal clear. The second criteria is frequency. You must increase your frequency of communications, because what this shows us is that the more times you see health information, the more believable it becomes. We looked at communications across the board from local health authorities, national health authorities, and global, as well as social media and podcasts. And notably, what we found here, looking at these 3 bars on the left, is that information that is coming from health authorities are much more believable compared to social media and podcasts. Social media and podcasts require more repeated exposure to become believable. However, we know that the frequency that we see with social media and podcast is that incredibly higher number, and that's where this interesting trend is coming, where people are turning to information there. So we really look at this and say that if health authorities can regain influence with greater frequency of sharing their information, they really do need to think about how can they employ that in their strategies. We appreciate that a local health authority cannot be sending out content on the hour. However, an increase weekly would really pay dividends as we think about how we can get that information out to communities where they need to find it with a higher frequency. Thirdly, empathy and accessibility. We found that people who say that they go to uncredentialed voices are doing it for, interestingly, two primary reasons. The first reason is empathy for my personal situation. And the second is because of direct experience with my issue. And we heard that these two reasons were the number one choices and the second choice across the board when we looked at age, gender, and political affiliation. People are really hungry and seeking out this empathetic approach and how people can understand where I'm coming from, meet me where I am. We believe it's vital that providers and health experts think about these qualities as they're looking at how they can better communicate with the communities they need to reach. And next, relatability. This is especially relevant for young adults. We know that if we want to reach that youth health ecosystem that Jen talked about, we have to leverage these relatable sources of health information that they are currently turning to. This is where that personal and approachable and human level approach really comes to the forefront. Whether that means the fact that people are in this age group are trusting people online that have similar conditions like me at a significantly higher, 13-point higher rate than those in the 55 plus group, or also the fact that this group is trusting individual content creators with medical training at 20 points higher. So it's incredibly important that we think about how we bring these two areas into our strategies. And lastly, proximity. You heard us talking about the power of going local, and it really plays out when we think about how we can really look at communications that will drive to influence. Proximity of going local through the voices that we know will build trust and strengthen that influence, and importantly, avoid polarization. As we looked across the political spectrum, where do we align collectively across different demographics when it comes to trust? It sits with my doctor first, and then it sits with local health authorities. So again, this trend of local that Jen talked about is so prevalent here, that locality of my doctor, my local health authority. But on the other side, we see where we differ. When it comes to global leaders, we see that those on the left are much more trusting and will seek out information from leaders of health NGOs. When we look at the right, we see that healthcare CEOs have a stronger standing with that group as well. So we should be looking at ways to elevate voices who are closer to people in our communication strategies, and also ways that we can pair global leaders with local voices and local partners that they are engaging as well. So bringing these 5 areas together, what does this all mean? We believe that there is a path forward to help organizations, experts, and the communities help to regain health influence, the roadmap that you see here in front of you. And let me take us through this. Where it starts is here on the left, where trust and perceived legitimacy are really the foundations of influence. But trust and legitimacy don't automatically mean that we're going to be able to deliver that influence to help people make the right decisions for their health and for their family's health. The key factor here is what we see in the middle. It's communications. To have better communications and to deliver that better communications, by doing so, we will have the greater likelihood that trust and legitimacy will then help you to gain influence and be able to share that information with people in a way that they will receive. We believe that while you think about where providers and scientists have high levels of trust and legitimacy, they have to compete in the current environment with so many other voices. We know that the medical establishment is losing the competition for influence because they're not communicating as effective as these other voices who look at things like relevance and frequency, bringing that empathy into communications, thinking about how we make sure information is accessible, but also relatable, and then proximity coming back to that locality that we talked about. So we do think that if scientists and physicians and other leaders in the health community can employ these criteria, we can really help to make sure that effective communications goes further. It doesn't sit just with thinking about lay language that we need to employ to translate the information. It's more than a better data visualization. It's really looking at these effective ways to make sure that the communications is coming through with the frequency, the accessibility, and the empathy that the public is telling us they're hungry for. So with that, Richard, I'll hand it back to you.
Thanks, Court. So what's really happened in the last 5 years since COVID is the generation most affected is Gen Z. And they have mental health issues. They feel, in a way, discriminated against. They feel that they've lost some years. They have built their own health ecosystem. They're cynical, they're angry, and frankly, they're finding their own way forward. What we are talking about here for all of you on the call is a move towards soft power. Science has always regarded hard power as the way to play. I'll give you the facts and you will follow my advice. Science has lost that privileged position. It now must share the role with people close to us. So the 4 points that we give you are we need to have, obviously, institutional influence. When reports come down from CDC, et cetera, they must be complemented by personal influence. Second, we have to give people the science and anecdotal evidence. At the moment, young people are saying, I believe what I hear from my friends. Fine. We're not going to contradict that. We're going to supplement it with facts and anecdotal evidence. Third, we've got to be with the youth where they are. We need to talk to those who are, in a certain way, their reference points, but also be on TikTok, put material that's of high quality in a place where they can find it. Lastly, we have got to have activated community networks. Again, the ground game, the pastors, the pharmacists, other people in the community who can supplement the voice of authority from the top. So now, Court, you want to introduce the panel?
Yes, thank you, Richard. So thank you, everyone who's joined us today. I really want to thank this remarkable group of experts for joining us. We've just heard the findings of the report and want to use this time we have together to really discuss the implications and how we can put these into practice, especially when it comes to the task that I know all of us are looking at in terms of how do we rebuild trust in health and science? How do we help patients and the public really make the right decisions for themselves and navigate this environment that is so volatile and consistently changing and a bit confusing, to say the least. So I'd love to introduce all of you to our panelists this morning. So let me begin. First, we're thrilled to have Dr. Celine Gounder with us. Celine is a practicing physician, clinical associate professor at NYU and Bellevue Hospital, as well as a CBS News medical contributor and the editor-at-large for KFF Health News. She's a renowned infectious disease expert and a public health communicator, and her work spans clinical care, global health, and national advisory roles during public health crises. Welcome. Next, let me introduce Magdalena Skipper. She is a geneticist and the editor-in-chief of Nature, with more than 20 years of experience in scientific publishing. She is the first woman to lead the journal and help shape its focus on open science, interdisciplinary research, and editorial excellence. We're so pleased to have you with us this morning. And lastly, a warm welcome to Caitlyn Giannini. She's a content creator and a patient advocate. She's also a member of our Edelman Gen Z Lab and Global Health Creator Marketing team. She uses her platform to help others through authentic conversations about empowerment and identity. Welcome, Caitlyn. So I'm excited to talk about the findings that we just heard and really get your perspectives because I think each of you brings a really important dynamic to the conversation we want to dig in to. And I'd love to start with a question that to get each of your perspectives on. One of the interesting things we heard related to this state of empowerment that we're finding the public in when it comes to healthcare. Clearly, they are more confident than ever in sourcing their own health information, young adults especially. Against this crowded backdrop that we heard of so much health information out there, how can we help people to navigate, whether it's cutting through the news, the content, the information, and how do we help the public distinguish from what is a credible health source and what is really a misleading one, especially against this decentralized environment the data pointed to, this ecosystem with so many new players in it. So would love to hear your thoughts on really helping to distinguish those credible sources of information. And I wonder, Magdalena, could we start with you?
Sure, it's a pleasure to be here. Thank you. Um, it's a really, really important question. The first thing I would say is the fact that individuals feel so empowered is actually a very positive thing. It would be much worse if we were facing a situation where individuals were apathetic, very passive, and just waiting for information to be put in front of them. That hunger for information, comparison of information is actually, after all, as of a prerequisite for being a scientist, for being a researcher. And when we are all kids, we always ask questions why, and we all want to know more. That hunger for information is a very positive thing. Now, how do we harness this positivity as I describe it? I think it's really important. In some way, the part of the answer lies in your question already. From my perspective, experts, and I define that category very broadly, as we heard in the presentations, sources of information, how they are presented, come in different shapes and sizes. So these different experts need to be present on different platforms. Through those different platforms, they will be addressing the widest possible audience and addressing their different needs at different levels. But whatever the platform, the information that is provided always needs to be, in my view, supported with a source. And most importantly, it needs to come with a sense of the level of certainty as to is that claim really 100% robust? Does it apply in 100% of cases? In other words, is it scientifically verified? And if so, in which population when we're talking about health, or is it more anecdotal? I think that communication of uncertainty is really, really important, regardless of the medium. So that's what I would contribute to that answer.
Oh, absolutely. I think that really speaks to the moment of what we're seeing. Celine, how do you look at this? How are you seeing the sort of the valid, credible information and the sources of misinformation out there impacting what you're doing every day?
Yeah, unfortunately, I think some of the efforts that have been made to help people distinguish between what is high quality information versus what is not, at least so far, have not been tremendously successful. That's not to say that there aren't approaches that may work, but I think there's just a lot more to be done in this space. So, for example, during the pandemic, some of you may recall there was a collaboration between the National Academy of Medicine and Google to see how they could elevate higher quality content on YouTube by credentialing institutions, individuals. And one of the problems with that is sponsored content is still elevated above that. And so, so long as that is the case, that kind of vetting doesn't really get you much of anywhere. Secondly, having myself applied to be one of the vetted, credentialed people, that there seems to be a bottleneck in that entire process. So if they're not able to expedite doing it, but in a reliable way, you're not going to be getting those people on the platform to put the information out there. So, I think that's been a challenge. I think, yes, there are efforts to develop a curricula to help people learn to be more information literate, to learn how do you assess whether information is from a credible source or not. That needs to be better sprinkled throughout other content because people are not going to specifically seek out content for the most part on how to become more information literate. It's something that kind of needs to be sprinkled into other content that they are going to actively seek out.
I think such important points, especially the one of how do we make it easy? To your point, we can't expect people to go find it, so we need to really bring it to them. Caitlyn, from the work that you're doing, helping to create content, but also your own work helping to advocate and really raise awareness and empower different patients and communities, how are you looking at this topic?
Yeah, absolutely. I think when it comes to sourcing your own information, all we really have left, kind of echoing off of what Celine said, is that we really need to utilize our critical thinking skills because the reality of our day and age is that we can't stop people from Googling their symptoms and consuming media because that is what is relevant and current in our society. So I always try to encourage myself, my friends, my followers to make it a habit to really exercise that muscle of critical thinking because, while there is AI and there's dupes and there's fake news and there are all of these things that are happening in the stratosphere of the internet, we as humans still have agency over our own brains and the ability to still use our critical thinking skills. Obviously, it's sometimes difficult to discern, and I do still think there needs to be proper things in place to really help with creating a better way of sourcing credible sources. However, in this day and age, really what we have is our critical thinking skills. And I just really would encourage others to make it a habit to exercise that muscle.
The critical thinking muscle. Yes, it's good advice for all of
Mhm.
us. I think picking up on that point too, I just wonder, as we've talked about the non-traditional influencers that we're really seeing, especially with young adults, content creators, podcasters, those who are leading different kinds of forums and discussing health topics, we know that's not going away. So what are some ways that we can think about actually engaging them more effectively? And specifically, when we think about the future of health education, are there ways that you think we could be really thinking about them in that vein of health and for health education, and ways we could be effectively engaging them with things that providers are doing or other initiatives ongoing? And Caitlyn, I wonder, just since we just touched on it with you, do you have any thoughts on this?
Absolutely. Yeah, I believe creators are the present. Whether we like it or not, they are here and they are here to stay. And they are what is really moving the needle of influence in today's day and age. If you think about it, these creators are posting usually multiple times a day and they are nurturing their followers and growing. And with that, eventually leads to this bubble of trust amongst their followers. People really turn to creators for comfort. And so I really do believe and know just through my personal life of content creation and then also through working on the creator marketing team here at Edelman that creator marketing is the nexus of trust and influence. It is a very, very effective and great way to utilize these, really specialized communities that creators have built and facilitated. And not only do they have these high following numbers, but the good creators really nurture their following and really truly facilitate that trust and relationship. So I think turning to creators rather than as something that is intimidating or scary, I think really leaning on them because overall health is such a personal experience. And I think the industry, as kind of what's shown through the data of this report, is that we're really looking to humanize the healthcare experience. And through creator marketing, I think there is such a great way to really tap that market that's looking for just like comfort and care and trust. And also while still maintaining that level of, when we're doing healthcare creator marketing, there are so many rounds of legal and regulatory review, and there are so many things that we do to ensure that this content is in line with all the FTC, FDA guidelines. So there are really multiple levels of trust at play when this comes to play.
Celine, is there any part of this as you're thinking about health education? What do providers need? How do you help patients? Like, how are you thinking about these new forms of content, about engaging podcasters or content creators or others?
Yeah, and by the way, I had my own independent podcast myself, so I
Yes,
kind of have
yes.
that perspective as well. But I think there needs to be more collaboration between the credentialed experts and the lived experience influencers, so that you have the combination of the empathy, the lived experience, and the credentials, so that people know, yeah, this is also trusted information. What does that look like? Is it that you have the face of both, so to speak, together, or is it some credential that's being given to the influencer? That I don't know. And what we saw from polling, for example, from KFF, where I work, as well as others, that the combination of the two is what was most credible and impactful during the pandemic. Very often it was a little bit different, I guess. The celebrity type would bring in the eyeballs, and then the
Mhm.
expert would provide the information, and then that combination worked well. Um, Whether that continues to be the case today, I am not sure. I think things have continued to evolve, and I think it is time to reassess some of that, frankly, with new polling. Um, so, I think that's something to be thinking about. I also think what was really interesting to me from this data was that the common wisdom, so to speak, until now had been, if you want to engage on health issues, moms are the target audience. Until that point, the common sort of wisdom was that people don't really engage with health issues. They don't really pay attention to that until they start having kids. And it is true that moms have been a way to radicalize, unfortunately, women in terms of starting with vaccines, for example, at the top of the funnel, and then getting into more and more radical issues and fringe perspectives. That said, I think what's really interesting, and something that I just sort of my gut feeling had been telling me, but it was interesting to see in the Edelman data, is that young people really are engaging with health issues, and not just mental health. That they are doing so across the board, and I think that is an opportunity to be engaging. And some of that can be starting very early with teachers and so on in the community. How can providers be working in collaboration for classroom projects? Um, one of my neighbors here, for example, for their high school project, had to develop a podcast on health issues with her classmates. And so that was a really cool opportunity to learn about how do you do these kinds of things as a creator, but then to be doing it in conjunction with experts in the community as well. So I think there's a lot that can be done, again, collaboratively, that we need to be exploring.
It's so interesting, and I agree. I found that data very interesting, because I too had sort of thought that those were not going to be as high as they were, and to see the level with which young people are indeed very much engaging, sharing that information, it does point to, I think, an untapped opportunity that speaks to sort of where that youth health ecosystem is. Magdalena, as you're thinking about what you're doing at Nature, or thinking about the scientific community and perhaps specifically young scientists, like, how are you thinking about bringing in these elements, whether it's content creation or just communicating with that community and two-way communication in new ways?
Thanks. I was actually going to extend a little bit what was said a second ago, but that will lead me into answering your specific question. I wonder if sometimes we collectively not help ourselves by overemphasizing these boundaries, or defining individuals as only ever wearing one hat. So we're thinking, oh, here are these scientists, and here are these medical providers, and here are these content creators, and these are my neighbors, and this is somebody else and somebody else. Well, the reality is that each one of us wears many different hats. I happen to be editor-in-chief of Nature. When I was in active research, I was a geneticist, but I am also a member of the public. I am someone's neighbor, and sometimes I create some content. In my case, not very professionally, but nevertheless, that's the case. So perhaps collectively as a society, we should be more engaging and more tolerant of one another and in fact encourage, for example, scientists to create content. The professional content creators could be there on help. So really extending what Celine was saying just now, capitalize on these different qualities of these different sort of parts of the society, because there are no fixed boundaries there. So coming to your question, the specific question that you asked me just now, of course, at Nature, we communicate the research that we publish in a number of different ways. We publish original research, but Nature also has a magazine part to it. So part of my team is made up of research of reporters, science reporters. We publish opinion content. We don't just publish written word. We have a multimedia team. We publish video content and podcasts. And we are very present on social media. So it's very much a mixture, engaging with different stakeholders, different recipients. And we definitely encourage, in fact, we profile researchers who engage with the general public, who engage in different types of content dissemination. Just to give you one example, we have an award, and we have a number of Nature awards, but one of the awards we have is called Science in Shorts. And it's an award for a short stand-up routine that is scientifically based, right? So here, through stand-up comedy, trying to encourage usually early career researchers, but not exclusively, to communicate factual information to the general public through this rather unusual medium for a scientist. So I would advocate for looking beyond these boundaries and capitalizing on these different qualities. That's certainly what we try to do within Nature itself. And that includes, and one final thing I would say, that of course helps trust in facts and research that underpin health advice, but it also makes that research better, because of course, we talk about communication sometimes as if it's one-way broadcast, but really it needs to be a conversation to become better.
The conversation, the collaboration Celine was talking about earlier, I think those are such important pieces. And I love the sort of point of breaking boundaries and not looking at people in specific silos, but really looking at the multiplicity of what people are bringing to the table. Celine, I think one of the shocking statistics we saw was the sort of the collapse of where trust is when it comes to media's coverage of health news. And I know, talking to a number of sort of peers across the media, this is really hitting home as such a hard thing to see, and questions of what can we do? And I'm curious whether it's sort of what you're doing day to day or talking to your colleagues at KFF Health News, what do you think we need to do to help rebuild trust in the health media, in media in general? What are ways that we can change how health and science stories and conversations are being covered to help bring back that influence and that credibility? It's a big question, but are there any places that you think we need to start? Are there things we need to think about as sort of guiding principles there?
Yeah, I think it's a challenging one. So as somebody who does work in legacy media, both CBS News and KFF Health News, I don't have a clear answer for that. And part of the challenge is some of the attack that media is under right now. Some of you may have seen that we at CBS just had somebody step down from 60 Minutes because of concerns about editorial freedom and censorship and so on because of the political environment. I think that further increases distrust in legacy media, unfortunately, and I don't have a good answer for how to address that. I think you also have an environment in which the business model for journalism is unclear moving forward. So you have advertising, which has been siphoned off by big tech. You have subscriptions, which only a very few organizations, companies have been able to make work as part of their business model in a sustainable way. You have the billionaire philanthropist model, but that also has its own risks, in particular with respect to editorial freedom again, which again impacts trust. And then there has been an influx of philanthropic money to support nonprofit journalism. Most of that has been really focused on local nonprofit journalism, which I think is actually the right emphasis because we really need to build that up. And that does dovetail with some of your findings in terms of the importance of local with respect to trust in health media. So that may be the place where to be focusing if we're really interested in legacy media and trust in health news.
Lots of issues. I think those are really important points, and the going local component does seem to be the place we hear a lot from, is like that is a really important place that maybe we could make inroads and then try out and see what's working to apply to other places. Magdalena, I wonder, as you saw the findings in the report about the increased rate in the fear of medical science becoming politicized, especially because it was 7 points higher today than it was during the pandemic when we had so many conversations about that very topic. What does that say to you about the current moment? How are you thinking about those specific issues? And I think how it relates to how does the science journalism and the scientific community still operate with sort of that rigor and objectivity when we're also hearing about this desire for openness and empathy and how we're talking about health and scientific issues?
Well, this is a very rich question. There are many things that you touched on there. Let me first make a comment about politicization of research of any flavor, whether it's medically relevant or not. So in and of itself, it's not a new phenomenon. If you look back in history, we've seen politicization of one kind or another influence research in the past history, going back all the way to Galileo and his conflict with the church. In recent times, we've probably all gone to see Oppenheimer in the cinema or watched it in the privacy of a home or wherever it was. The Manhattan Project is probably the most famous scientific project of the 20th century. It's impossible to question that it was a politically motivated project. So in and of itself, the phenomenon is not new. What is new is how incredibly prominent this politicization is today. And especially since the beginning of the year, it has become even more prominent, and certainly in the pages of Nature. If you look at what we cover, journalistically speaking, we cover how politics is affecting how science is done, including at fundamental level, and what can be pursued. So a little bit in parallel to what Celine was talking about, the sort of loss of credibility or the threat to credibility of media. I am concerned about effects of credibility on research. But the second part of your question was about openness of science. And of course, the openness that is demanded by the general public, and incidentally, increasingly by the research community itself. And now we're getting back to the fact that it may not be necessary to make these distinctions between these different constituencies or different stakeholders. The openness is incredibly important. Openness is absolutely necessary for trust. If anything, openness enables demonstration of the rigor with which science is done. It enables exposing any potential fraud or bad actors, which in and of itself helps science itself as an enterprise, and it helps trust. So I think that openness is really important. Your own data shows that transparency is absolutely key to your respondents. And incidentally, so is human connection. And I think that's something which is also very important for the research community. In my mind, it goes hand in hand with that openness. So the human connection, the human side of research, and openness and transparency, absolutely key.
Absolutely. Caitlyn, as we're sort of picking up on that thread of the desire for more human connection, more openness, and we're thinking about young adults and what we're hearing from them. I think one of the most shocking statistics in the research this year was that nearly half of young people felt that they could be as informed as a doctor if they had done their own research. And an increase of over 7 points in just the past year, which is really quite notable as well. So curious where you're sitting today and just amongst your peer set, what do you make of this? Did this surprise you? Does it feel absolutely what you would expect? And I think the related part is, what do you feel it would take for someone your age to then see someone as a medical expert they want to listen to and trust?
Yeah, I think when I first read that statistic, I was a bit shocked, but then I sat back and I really thought about it and I realized it actually makes so much sense. We as a society have information at our fingertips at any given moment, and we can self-diagnose and look up our symptoms. Even if you're feeling, you have a slight cough, suddenly you have this, health condition. So I think it's really important to remember that now, because humans do have the ability to go on the internet and search their symptoms, there is a lot of self-diagnosis that is happening. With this, obviously, through the data, we're seeing that people do feel as though they have the tools to diagnose themselves. So when you walk into a doctor's office saying, I have XYZ symptom and I believe this is happening, if a doctor is to immediately just be like, no, and shut you down and not really hear out all of the full list of your symptoms and all of your fears, I think it really can put up a wall and just kind of further perpetuate this distrust that we're speaking of. So how might a doctor earn trust, a medical professional, healthcare professional? I really think that doctors need to humanize themselves. I think health is such a personal experience. Every single person, even if you are having the same condition as someone, everyone has so many different factors, whether it's genetic or whether it's their lifestyle. Everyone has their own different set of conditions that align with how they're feeling. So I think it's super important for doctors to take every person as a blank slate and really take the time to care for them and look at them in a human first way. And I think that's kind of tying the bow around the whole message of content creators. That is something that I do think doctors could lean into a little bit more. I think we're in a day and age where professionals should no longer be scary. They should be relatable and they should be human. And creators are sharing their stories online all the time. I content create and I share my own personal health stories, whether it's about my limb difference or something that's happened to me. And I think people just really want a friend and they want someone that they feel can trust them and really, really are listening to all the nuances of the things that they're feeling.
I think that puts a really great, concluding note on the conversation this morning. I think really speaking to what people want and what they're looking for right now, that human connection, as well as when they're thinking about their own healthcare needs and their personal situation. I want to thank each of you for joining us. This has been such an engaging conversation. I've taken so much away from it. I hope you and everyone who's watching has really learned so much and will be taking away a lot of really great insights about where our healthcare, community is right now, about the future of where we're headed across health and science. I want to thank you all so much for joining us and helping to enlighten us on all of these issues. And with that, I'm going to hand it back to Richard.
So thanks, Court. I think attitudes have hardened 5 years after COVID. And what we see is a fundamental change in the picture. Science now needs to regain the trust of society by, in a way, behaving differently, by having its scientists available and making sure that stories are frequent, that the science is understandable, that it's relatable based on personal experience, and it doesn't take away from the power of the science. It only adds to the credibility of delivery of the message. So it's an and, it's not an or. And we need to take this very seriously. I'm really proud of this report. I think it's a significant contribution to the discussion. Now, for the next one, we are going to, for the Can Ad Festival in mid-June, release a study on trust in brands. We're going to be looking at the future of purpose campaigns. We're going to be looking at trust in brand US, which arguably has been affected in the last few months. And we're also going to be looking at the extent to which this kind of creator-led information is much more powerful than advertising. So I'll look forward to seeing all of you before I go off to Cannes. And thank you very much for joining us today. Thank you so much to the panelists, Courtney and Jen in particular. So long.